Alright, so nice warmed up foot, got some circulation going there, nice and moisturized. So we're going to move into the body of the session. Get a little bit more lotion if you need. Now, you can vary where it is that you start, but I'm going to share with you where I start. And it works, so I do recommend it. So I like to start sort of down here on the corner of the heel. You can do circular if you want. If you find something that feels like it just needs you to stay there for a minute, I highly recommend you trust your intuition in this whole process. It is the most important piece of all of it. It's how this technique came to be in the first place. Trust yourself to find the areas that need attention. You can use both thumbs. Notice sometimes I'll use that hooking that I describe in the booklet. Sometimes it'll be straight. You're going to find all kinds of neat little bumpies and crevices and different things down here. Don't press too hard in this patty area. You can bruise here. I just want you to help you loosen up the tissue. But again, trust your intuition, because we won't usually press too hard in an area where we shouldn't if we're following our intuition. Alright, so you can work all around here. Feel your way around. It's actually kind of a neat way to learn the anatomy of the foot. The next level of training that we're putting together is going to include a lot more on anatomy. We're going to move into some other areas of working on this as well. But you are going to find a ton of relief from what you have here. Okay, so get around the outside too. You might be asking, could somebody else learn how to do this on me if I get tired of doing it on myself? And the answer is yes. We have all of that in the works. Okay, so we are going to move, as the booklet says, we're going to slide down this slope here, off the calcaneus bone into the tissue. Now, if you're like a large percentage of plantar fasciitis sufferers, the bulk of your pain has most likely been here or begun here. Chances are, even when you have symptoms and pain in other places, anywhere in the foot, or even up from there, a lot of it has stemmed from this spot here. So, again, I like to slide down off that calcaneus bone and into the tissue, into the slope here, kind of like a water slide. And what you'll start to feel is, depending on the severity of your plantar fasciitis, you'll have some discomfort here as you maintain some decent pressure. And again, if it's your first one, you might be pressing a little lighter than your 10th one. I've obviously done this for 10 years, so I'm going pretty deep. And I would go pretty deep on you too if I had your foot in my hands, because I know that you'll get great results. But again, if you have to start a little bit slower, a little bit gentler on the first couple, that's fine. You will notice that after the first one, they'll get easier and easier. And any one of my clients over the past 10 years would tell you that. First one's the toughest, and then they get easier. Some people don't have any problem at all. It just depends. Depends on who you are, depends on how long it's been there, how severe it is. So as we work on this tissue, on this tendon, on this fascia, you're going to feel all the scar tissue that's happened in here, all the adhesions, all the kind of bubble wrappy, bunched up mess. I'm just going to say mess. And the idea, if you can set your mind to kind of breaking apart some of this accumulated mess that's hindering our movement and our mobility and raising havoc in here. And although it may seem like a strange thing to do, thousands of people will tell you it's the one thing that freed up their feet to move properly again and gave them their life back, essentially. Got them back on their feet doing the things that they love. So as I'm talking, I'm just doing the same thing over and over, and I'm kind of peeling away the layers, as I said in the book. Layer by layer, we make our way through this scar tissue. And it's not going to be a one-off. This is going to be a process. This is developed over time, and it's going to take some time to break apart. You will start to feel now that there's a lot of circulation coming in this area. It's starting to warm up quite a bit. Might have a little buzz feeling to it. All very, very good signs. When you feel like either you've had enough for this one, or time is ticking by, start to move your way up this tendon. And like I said in the booklet, if you lose that, some people have a real tight one here, and you can even see it like a tight guitar string. Mine's not quite that tight. If you pull back here on the big toe, depending on how flexible you are, again, I am because I've been doing this for a long time, you can actually start to see that guy pop up there. And you can access it again. You can move your way up to where it's attached here, which is another anchor point. And a lot of people have more of the same of that, mess up here as well. So just do the same thing. Go in there, work it out, use your intuition, use the little eyeball on the end of your thumb. Use the sensors to help you detect where the issues are. Feels so good. I've heard this described more times than not, because when you go for a deep tissue massage, it hurts good. I've heard it described as it hurts good. So it's not really pain, it's kind of like a constructive, it's different because you're being poked and prodded, whereas you're not used to. But people who get used to walking on the pebbly parts of the beach, or one of those cobblestone path mimicking mats that you can buy these days, you actually start to get used to that feeling. You start to get addicted to that feeling of getting poked and prodded there, which is actually what we're designed to be doing all the time. Poked and prodded on the bottom of the feet. People in third world countries who don't have shoes and don't live on cultivated ground like we do in our civilized countries don't have the plantar fasciitis issues that we do. Very small number of people, if any. And they also come and win all our marathons because they do theirs barefoot. So I'm not saying throw all your shoes out and go barefoot, because the truth is, and the fact is, that we live on flat, hard surfaces. And we have to, I have to be mindful myself of not doing banana thumb, because my thumbnail isn't, it's probably a millimeter longer than it should be. Also the angle. So this one wants to banana thumb, so I'm going to use this one. Lines up better from that angle. So we live on flat, hard surfaces. We need some of those things to help us along, but we also need to help ourselves by doing the homework that is also included in the booklet. So get out as often as you can barefoot on uneven surfaces. Find cobblestone paths, find rocky parts of the beach, find trails, find natural, uncultivated ground. Do barefoot or wear a very minimalist shoe. Like a Vibram 5 fingers are my favorite. They even keep your toes separate. So, again, I'm moving up the main tendon. As I continue on in the treatment, I'm going to pull back the toes here and work up these littler tendons, which you'll feel as soon as you pull those back. You'll feel those pop out. You will feel some of that mess action on those tendons as well. Go in there, work them, use your intuition, bring that circulation in there, break apart some of that scar tissue. Often if a person's got pain up in this area, it stems from down here. So don't worry about working directly on that right yet. Not deeply anyway. I definitely want you to work on it, but go light for now. Really, when you're getting your elbow grease into it, work the tendons here. Pull toes back if need be. Work those tendons. I can feel a little bit right there. So if you feel a little bit right there, you just give it a little bit extra.